Thank you, Human Body Systems Group. Good afternoon. This is Kim and I'm here to talk about the third class in the Project Lead the Way biomedical track, medical interventions. The class highlights medical interventions aimed at preventing, diagnosing, and treating diseases. Students perform multiple labs, such as the ELISA lab, which is typically used to detect antibodies in the blood. Also, students perform a PCR amplification lab using their own DNA. During this course, students discuss current health issues such as cochlear implants, vaccinations, and antibiotic resistance. To help the students learn about today's medical interventions and health class problems, the class is introduced to the Smith family. Students complete a family pedigree throughout the class summarizing health issues and medical interventions experienced by each family member. As a part of this report, I interviewed 3 of the Smith family members. Here's a short video we put together summarizing their experience with medical interventions. Thank you for letting me speak to you today. I gathered a tremendous amount of information about medical interventions while researching the MI class. After analyzing all the information, I realized there was no way to share this information better than speaking to the family who experienced it all. Hopefully, through these interviews, viewers will gain a better understanding of what a medical intervention is and how it applies to their lives. So thank you again for sitting down with me today. Why don't you tell us a little bit about yourself?
Absolutely. My name is Judy Smith and I'm married to James Smith, and my son is Mike Smith, and my sister is Diana Jones. When Project Lead the Way came to our family about being part of their curriculum, I wasn't so sure about going along with it. Honestly, without some of the medical interventions my family has encountered, our lives could have been altered drastically, and I think it's important for people to know what kind of help is out there.
So to begin, why don't you tell us about the most important medical interventions you've encountered?
Well, most importantly, I've had plenty of imaging and testing done on my developing baby. Especially for newborns, the more doctors know ahead of time, the better. Prevention is the greatest thing you can provide for your child, and it can be done before they've ever been born.
Do you mind giving us a few examples?
Well, as many people are aware, during a woman's pregnancy, they are scheduled to have multiple ultrasounds. This can help detect birth defects, gestational age, fetal size, and other prenatal information. But the most important test during my pregnancy was called an amniocentesis.
Thank you. For our viewers, we have a video of Dr. Wade giving us more details about the test. The procedure is done between week 14 and 20. Doctors will take a small amount of amniotic fluid and with it test for chromosomal abnormalities, genetic disorders, and neural tube defects. This gives doctor and the family prior knowledge of any harmful diseases or deformations. The sooner we know, the more prepared we can be to help the infant after conception.
Along with the amniocentesis, I will also make sure that my child gets all of the neonatal vaccinations recommended.
Currently, our nation is facing a vaccination debate. Many people believe vaccinating newborns could be the cause of autism or similar diseases in their child. However, evidence from scientific studies has not shown a link to autism due to vaccinations. Also, some parents believe their children are safe from contracting a disease because it's either eradicated from the U.S. or think their child is not at any risk. Multiple outbreaks of diseases unseen for decades will show these parents otherwise. Needless to say, prevention is the greatest thing you can do to protect yourself and the ones around you. Here we are in front of Diana Jones's house, sisters of Judy Smith. Let's see what she has to say about medical interventions.
Hey, come on in. Welcome. I'm glad you could make it today.
Thank you, Diana. Why don't you tell us a little bit about yourself?
All my life, I've been struggling with weight loss. Having type 1 diabetes does not make it easy for my body to function properly. A few years ago, I started a diet and exercise plan. I lost a few pounds, and now I have my high blood pressure and diabetes under better control.
So is there anything else that helps you control your diabetes?
Yes, once I was diagnosed with diabetes, I was given an insulin pump, an instrument that gives my body the insulin it needs but cannot produce on its own.
Interesting.
Unfortunately, last December, I was diagnosed with end-stage renal disease, and for 6 months, I was put on dialysis while they searched for a kidney donor.
And did they ever find you one?
Thankfully, yes. Scientists have developed a tissue test to find the best donor possible. As it turns out, my brother Lewis was the best donor. I was able to have the transplant surgery, and now I am off of dialysis. However, I will always have to take immunosuppressive drugs so my immune system doesn't reject my new kidneys.
This is great. Anything else you'd like to say to our viewers?
Thank you for letting me share with you. These and many more medical interventions have saved my life, and I'm so thankful to be here today.
And here we are back at the Smith family with Judy's son, Mike. Let's see what he has to say about his medical interventions.
My name's Mike, Judy's my mom, and Diana's my aunt.
Thank you, Mike. Can you tell us about your life before osteosarcoma?
No.
Mike!
Fine. At the time, it all seemed to happen so fast. I had an X-ray, MRI, CT scan, and bone scan on my right arm. When they finally said it was osteosarcoma, I didn't even know what that was. They performed a bone biopsy and explained to me how osteosarcoma is a cancer that starts in the bone. It's also not uncommon to be found in someone my age.
Sounds like they caught it early then. That's good, right?
No, I wish it would have got me. Yeah, they did catch it, but the chemo treatment I was getting didn't do much to help. Everyone responds to chemo differently, something that can be said about most treatments or medications. The cancer was beginning to spread to surrounding tissue and blood vessels, so to stop it, they cut my arm off.
At age 16, all of this must have been extremely scary.
Yeah, it wasn't easy to adjust to going through chemo and then losing my arm. But they gave me a prosthetic and things started getting better.
During the curriculum, students are tasked to construct a functioning prosthetic hand that can grasp a styrofoam cup. Although these products are not ready for patient use, they do give students an idea of how they work. Here's a clip of an actual MI student's prosthetic hand.
Now, after a bunch of PT and OT appointments, I've learned to live with my prosthetic arm and I almost feel like my old self again.
Thanks, Mike.
Yeah.
Thank you, Smith family, once again for all of your cooperation. As you can see, everyone encounters medical interventions almost daily. Whether it be an ultrasound to detect the size of your baby or an insulin pump to supply your body with insulin, medical interventions make an impact. Students who decide to take MI will be able to learn more about the biomedical innovations we share today and many others. Thank you for your time and good afternoon.